Good morning, Milwaukee. Good morning, family. This is Deb Nevels, your host, your co-host, along with my host, co-host, Mr. Ronald Hayes. You gonna say good morning to
Good
the
morning.
people? Good. Thank you, Mr. Hayes.
Good
Thank you,
morning.
Mr. Hayes. This is your helping you.
Something here. I
Yeah,
just want to interject this.
please.
You are the host. He
Okay.
is the co-host.
Okay. Thank you
You're
for the
not
correction,
co-host together.
man.
You're the standing host, and you bring in co-host from
He's
time
just
to time.
he just
Okay,
gonna correct me.
we got
That's
that.
we got that. Yes,
All right,
sir.
moving right
Thank you.
along. That's
It's
why Jermaine gets paid the big bucks.
that's what
Super
Jermaine gets.
producer.
Yeah, because I push buttons.
You push buttons. Look, you push mine.
That's it. I push buttons.
Debo.
Mr. Ron Hayes joins us today. Health
Yes.
Griot.
Yes. Thank
Okay,
you.
okay, Deb.
Thank
Carry
you
on.
for correcting.
Carry on.
May I thank you so much. Family, you hear me. I'm here with, as always, two brothers that make everything possible, make things happen. Mr. Jermaine.
God bless you.
God bless you too. And Mr. Debo.
And you know what? Since you called my name, I wasn't gonna say nothing, but you called my
Yes,
name.
you were.
There you go.
No, I just wanted to thank you, Deb, publicly for the awesome event that we were able to have at Thrive on King. And I don't know if you noticed who wasn't there. Jermaine.
I did.
Yeah.
I wasn't gonna say anything.
See how they do me?
I
But
figured he
no, I
slept
wanted to thank
in.
you publicly. Awesome.
Oh,
Ms. Z, the entire staff, just so helpful, and we couldn't have done it without you. So we certainly appreciate you and the fine folks down there.
well,
Thank you so much.
I appreciate you all for coming out and selecting and helping us activate that space, as we always say.
Hmm.
And it's so important to us to have community coming into that building and using that building because it was designed for the community.
Hmm.
And there's nothing like having you all there, having WNOV, the long-standing community voice.
Thank
Couldn't
you so
do it
much.
any other way.
No, you just know how to say things too. The long-standing community voice.
Long-standing.
Ah, boy.
Yes, yes, yes. Even though some people didn't show up, that's you all are so kind to allow people to just.
Well,
For those
there
of
were
us that
some
were
people.
there,
There were some
6
people that
a.m.
wasn't supposed to be there.
Oh,
See
okay.
how they do me?
What? Huh? What?
See, he keep
You weren't supposed to be there.
see, he keep hitting on. I was supposed to be. Well, I
No, he
wasn't
wasn't.
supposed to be there.
He was
But I
here
was supposed
making
to
sure
be
we
there.
stayed on the air.
He was here. Oh, okay, okay.
Yeah.
See,
Somebody had to keep the house
I
open.
mean, but while they was having fun and eating, I was
It was-
studying.
You were studying.
Yeah, I had to be here.
Okay.
Yeah, he
It's
was
okay.
studying all right. He
You
was-
couldn't come out the house. Family, y'all hear this. You hear what happens. You hear early in the morning. But yeah, that was a phenomenal program.
Yeah, really enjoyed it.
Mr. Doug Kelly said we were going to do that once a month.
No, he didn't. He didn't say that.
Milwaukee family, if you all know, that was a lot of work.
Oh yeah.
Logistics. Mr. Debo was out at Thrive On multiple times to make sure that everything came off without a hitch.
Yeah.
And people were lined up at 4 a.m.
Yeah, I actually took pictures of some people
Did you?
lined up out there like they were at a Brewers game or something,
I
like
know.
tailgating. They were lined up trying to get in there, making sure.
They wanted to hear the long-standing community
They
voice.
want them gift cards too. Now that
Yeah,
might
well,
have
that
had
part.
something to do with it.
Yeah, that was a little bit of it. That was a
Yeah,
little bit of it.
yeah.
But it was the program you all put on was phenomenal.
Yeah, we thought it was
Information.
good.
Yeah.
A lot of thought and work went into that, Deb.
Mhm.
And as you know, from the food to serve, I mean, just
Oh.
every aspect. I'm sure Miss Z was tired of me because I stopped calling and making an appointment. I would just show up.
Just show up. She'd be like,
Hey,
oh,
I just need to check this right quick. Well, I'm doing a tour right now, so I'll be with you in a little while. I just started just showing up.
just show it up.
She
Just show
never
it up.
pushed back or anything.
Mhm.
It took some doing, but we got it done. That's the long and the short for me.
Yeah, well, that Thrive On staff is phenomenal, and I do have to shout out Delectables by Donna. Phenomenal. She put some food on the table that was incredible. We always love whenever Donna can bring her skills to the table. But yes, it's the medical college is thrilled to host and thrilled to bring um, bring you all into the community. Yes. All right, fam. So first, I'm gonna talk introduce Mr. Ronald Hayes. Today's show, um, Your Health and You. We brought to you by Medical College of Wisconsin. We are thrilled to be able to come before you these mornings to talk a little bit about your health, give you some education around your health, and let you know what things you can do to make sure you're proactive, getting your screenings, talking to your doctors early, having that medical home where you are feeling connected to your health care. And Mr. Ronald Hayes is here as my co host today. Um, he is a health griot. And Mr. Hayes, I want you to be able to introduce yourself and talk a little bit about what you have experienced and what brought you to our program today.
Good morning. Well, my experience is because I'm a prostate cancer survivor. Um, my journey with my prostate health began really early in life. Is in the sense of that I was in the military for uh, many years, and there was always test examinations that we had to do on a yearly basis. And I became aware that I had an enlarged prostate when I was at age 55, and I had an operation at that age to have it reduced. But I was always looking at my prostate health on a regular basis, seeing the doctors on a regular basis. Uh, when I turned 74, I developed um, prostate cancer, and I had an operation to have my prostate removed at that time. Um, and that was exactly 10 years ago
Mm,
that I had that operation. So on my next birthday, which is just next month, I'll be 85 years old. But I have been consistently uh, seeing the doctor on a regular. I see the doctor twice a year, and my blood is drawn, and my levels are very very low, 0.0
mm,
point zero. So I'm cancer free. I'm part of the Men Moving Forward program, and I'm also one of the griots. And I work out regularly with the Men Moving Forward program. I've changed my diet. I, as a matter of fact, I look forward to working out because I was an athlete when I was in high school and
mm,
college. So it's kind of I'm a jock. One of my college roommates used to say, you don't be a doctor, you die. But that I've I've bonded with men in the program that become more like brothers to me, and it's become more of a health factor just to go to work out with them and fellowship with them because it mentally it keeps me healthy and
mhm.
strong.
So, Mr. Hayes, if I can ask, so today our focus and our topic is on our family tree, talking about your cancer history with your elders, your health history with your elders. Was there a family history in your diagnosis? Did anyone else in your family have any types of cancer, or specifically prostate cancer?
Interesting that you asked that question because I was talking to my sister who's 1 year older than I am just this past week, and she actually told me that I was the first in the family
Oh, wow.
to have prostate cancer. But then we started looking at the ages of our parents and how they passed on.
Mhm.
And my grandfather died when he was 60. My father died when he was 42. I had uncles that died that they were in their 60s. So she said, "Well, Ronnie, they probably died before they realized they had cancer." So
Mm,
she said, "You're the first one in the family that's really been able to tell the story of having survived prostate cancer.
Okay.
So it's when you look at when I look at my age and the lifestyle that I had versus the lifestyle that my parents and my grandfather and father and uncles had. Um, my background, I'm an accountant, so I don't do the kind of work that they might have done. So their bodies might have not have, you know, might have broken down for other reasons other than work.
Yeah.
Work might have been the reason why their bodies broke down. So their lifespan was not as long as mine because I've been a professional in a sense of my work,
Hmm.
but I've been an athlete as far as what I do, as keeping my body
Sure.
strong.
So it's interesting because you said you and your sister were talking. So you have that open communication and talking about your diagnosis, which is so critical. Many times within our families, we don't talk about it,
Right.
and having being able to talk about it is really critical. Have you shared it with other people beyond your sister?
My my experience.
Yeah. Yes, your diagnosis.
Oh yes, yes.
Good.
Oh well, I have a number of grandchildren that are male. I have 8 grandsons and 11 great grandsons,
Hmm.
and I kind of work out with them,
Oh,
as
great.
the leader. If Daddy can do it, you can do it.
Yes. You beat them at push-ups. I know you beat them at
Oh yeah,
push-ups.
yeah. That's part of. Yeah, we're all competitive. They're boys and they love to play the sport
Hmm.
that we all enjoy, football and basketball and that. But um, and my parents and my uncles as well as my dad, they were all part of my upbringing too, as far as my
Hmm.
athletics. But yes, I I shared it with them.
And you talk about the health griots and the fellowship and the importance of that bond. We just last week, it doesn't
Yes,
seem like it was last week, we
yeah.
celebrated your second annual celebration and kickoff lunch, and we had that. What's your reflections on that? Why was it important to do that celebration?
Well, one was number one being a health griot. I was pleased to be even selected to be one. Um, but the importance of having the community be a part of seeing us and being us to share our stories in with members of the community as well as the medical staff and
Hmm.
the people from the college.
Hmm.
uh, that was a good feeling because you the warmth there that I felt because of you doing something that was positive, but it was not like you were doing it. It wasn't like you were getting it doing it because you just won the championship or anything like that. It was just a feeling that you're feeling good about yourself and you
Hmm.
feel good about being able to share that. And
Hmm.
that was the best feeling at all, to be able to share how you
Awesome.
feel.
Yeah, it was a great celebration because you all also shared your skills of um, how you are able to tell your story. We heard from a few of you on that, on just examples of the storytelling, which was so important.
And that training came as being part of the program.
Mm.
The I think it was Ex Excalibur. I guess they
Oh, ex-fabula, but
Excalibur. Okay,
it's similar.
right,
They
yeah.
just as good. Yes,
and
but yeah.
and they we had 2 or 3 sessions of training, you could
Hmm.
say, and and
Hmm.
and 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 they sort of taught us how to tell your story and do it in a short fashion, but get straight to the point. But you want to make sure that whomever is listening can understand exactly where you are coming from when you're making any statements in regard to your journey in regard to this
Now,
process.
you mentioned that next month you celebrate your 85th
Yes.
85th birthday. So it's your long, wonderful life that you've had. What has that taught you about staying healthy and connected to family?
Well, I think about my mother often, and when I say that, because my dad was in service along with most other men during World War II. I was a pre-World War II baby. I was born 1 year before Pearl Harbor,
Mhm.
but those 4 or 5 years that the men were away fighting, it was the women that were raising the families. My brother, my older brother, and two sisters. It was three of us and four of us,
Mhm.
and my mom had all of us in back to back. So my mom used to brag when she was 36. She said I had all y'all by the time I was 20 years old. But but I look back at that and the things that I learned from her. And because my dad would always say, whatever your mother says, right.
Mhm.
Uh, it was things in regard to growing up, in regard to what I should do
Mhm.
when I left the home, in regard to what was out there in the street that would be something that I should avoid doing.
Mhm.
Uh, One of the things my mom used to always say is, "Don't never stick anything in your arm," and I never knew what she was talking about. I was a
Oh,
kid,
oh.
but I as I grew up to understand those things that she was
Mhm.
putting in my head. And I had men in my life that told me you treat a man the way you want to be treated.
Mhm.
So that's been a factor that I've lived as, and I try to do that with my young grandsons
Mhm.
in regard to life lessons. And so my daily life, I try to live each day as if it is my last, and thank God at the end of the day, because I had some goals that I set when I was younger.
Mhm.
When I was 21, I was in college, and my father passed. And I said, well, I want to live to be at least. He was 42, and I was 21. I said, well, I want at least to live to be 43. So when I got to be 43, then I said, well, I made that goal. And then I said, well, I'm going to see if I can double the 42. And when I made 84, I just said, well, the sky's the limit. So each day I treasure as a blessing.
Awesome. Do you remember, I mean, other than your mom telling you not to stick anything in your arm, d do you remember them telling you anything about how to stay healthy? Or are there any conversations you wish they would have had?
Well, I was the kid that got up early, and I was I was out on the playground. I was out, and my mom, in regard to raising us, she fed us, you know, good food
Mhm.
we were raised in with proper nutrition, but you could tell that when, particularly during the wartime,
Mhm.
when things were when there was rationing and things
Mhm.
like that during the wartime. So you could tell when things were short,
Yeah, a little tight.
that we had to, we ate what was available, and but once the war ended, and then the and I was getting older too, because I was in from grade school and into high school,
Mhm.
and then I was also, I was kind of I had my own paper route when I was a young
Mm.
kid. So uh, um, I I just, my mom was just, she was a strong woman,
Mhm.
and it was, she provided, and I followed what
Mhm.
her advice.
Mhm. How do you think, so we're coming up on the holidays. How do you think people can approach their elders about asking health questions? A lot of people don't want to talk about it, but how do we honor and respect our elders and ask those questions, um, to try to get more detail about our own family history? What do you think is a good approach?
Well, ask the elder how did they survive is a
Mm-hmm.
good question. I mean, what did you do? What kept you alive? What's keeping you alive? And I my grandmother, she lived to be 94 years old, uh, when if you have an elder in your life, just ask.
Mm-hmm.
Grandma, what do you do? What do you eat? What what makes you strong?
Awesome.
Right.
That's good ideas. Good ideas. You mentioned the brotherhood and the um, closeness of the health griots. How do you think that that helps to stay to keep to play a role? I can get the words out to play a role in men's health and men being able to stay healthy.
It's like a buddy system.
Mm,
You when you when you're in the military, you learn how to work together with another person. A perfect example, and I learned when I was an Air Force veteran, and then I went into the Army Reserve program, and I didn't have any training in the military in the Army in regard to building digging a foxhole, for an example.
mm,
And so once you learned that, and you found out that here's what happens in the foxhole. You put two men in the foxhole, and each person is back to back, and if each person is looking at a 180-degree range, then that's 400 and that's 360 degrees. You got
mhm,
the whole circle. So that buddy system becomes very important, and
mm.
that working with the men moving forward in the grid, it's a similar situation. You're protecting each other. If you watch my back and I watch your back, then we got this thing. Yeah.
I
In other
never
words.
thought of it as a foxhole and just kind of
Yeah.
watching each other's back. It just and
Yeah.
I'm blessed enough to be able to watch you all sit on the outskirts and see the work that you all are doing and the fellowship that you all do. Um, it's just really really important. What message do you have for younger individuals who are paying attention to their health um, and about being able to have longevity? What would a message be that you would have?
Well, one thing is, don't be afraid to go to a doctor. Don't be afraid to ask. Don't be afraid to seek education. And advice.
Mhm.
And then think of yourself as as you can do it if you believe in yourself. First, believe in yourself, and
Yeah,
and and then once you do that, then it becomes easier to start reaching out and seeking. Uh, uh, I have some young grandsons, and they just said that, well, I want to be like so and so. So, but you do that, even if you have examples of someone that you want to follow. If that person is a positive person in your life, then that would be my advice.
awesome. Thank
Right.
you. Thank you. Milwaukee family, we're going to take a brief break. I'm going to ask you to continue to listen, but more importantly, to call in that number 414-444-5250, 414-444-5253 to get your voice heard on the other side. We have another guest that's joining us, and we'll do those introductions when we get back. Talk on the other side. Good morning and welcome back to Your Health and You. This morning we are blessed to be able to talk about our family tree, talking about cancer history with your elders. And we just heard from Mr. Hayes, who is going to be celebrating his 85th birthday on December 8th. Um, yes. Mr. Jermaine is already throwing the gauntlet as far as he told us that he can do 100. His last birthday he did for they do birthday celebrations with the health griots, and part of that is doing push-ups. He did 125.
Listen here. I'm putting it out there now on WNOV. We are throwing a super event
Super
for his
event
birthday.
on his birthday.
All bets is on this guy. So you can pay into me, and I'll make sure that he get his money.
Lord,
Jermaine's throwing this party.
Jermaine's throwing the party.
We're not underwriting this in
No,
any way.
at all. Nor is it medical college. No,
Sponsored
we
by
are
A
not.
and J Liquor.
Yeah,
No.
there you go. There you go. You and A and J can throw it.
Father, help us, help us. We got a caller, family. Come on, line. Come on and help us get out of this hole that Jermaine is trying to dig us. Man,
Good
Good
morning.
morning. Good morning. How are you
This
doing?
I'm blessed. This is Angela. How are you?
Hey, Miss Angela. I am
Hey,
well. I am well. What?
that's great. Mr. Debo,
Uh
Mm-mm.
oh.
I heard that you was talking about that hat that you didn't get from the little event.
Mm-hmm.
I got you.
Oh.
Okay. You can
I
drop
got
that.
one.
Drop that by any old time.
Yep. Everything I get stuff like that, I washed it. So, it's all good. So you can get, I'm going to bring it to you.
Okay.
Miss,
Yep.
Miss Angela, thank you for looking out. That's important.
Oh, yeah. They're my peeps. I got them.
We can't do nothing without family. Can't do
That's
nothing.
right.
How's
That's
your health
right.
been, Angela?
It's been up and down. I'm taking a different route. I'm not gonna. I ain't giving up, but
Mm-mm.
I'm just gonna take a different route from getting these doctors going to this one and going to that one, and they want to give me this shot, they want to give me this shot, and they want to give me this medication and that medication. So I'm just saying no.
Mm.
But I'm just trying something else. I'm just gonna try to go with the holistic medication, see how that works.
Mhm.
So far, I talked to a few people that does partake in that.
Mhm.
So I'm gonna see how it's gonna work for me.
All right.
Well, all right, Miss Angela, we're gonna keep you in our prayers. You're
Thank
gonna
you very
be
much.
you're gonna be um uh in our prayers and thoughts. I want you to continue to move forward and keep positive as you always do.
Oh yeah, yeah.
So yeah.
At one time I was about to give up on myself, but then I said,
Mm-mm.
no, that ain't the way it's supposed to be.
No,
I'm
we
supposed
start
to
looking
keep
for you.
going.
Yeah, we
I'm
start
supposed
looking
to
for you.
keep going. Long as he wake me up every morning,
There you
I
go.
got another day.
There you go.
Miss Angela, I just wanted to tell you that giving up is not an option. So you got to
Mm-mm.
take
Oh,
that off the table. You got to take that
Yep.
off
yeah,
the
I
table.
know, I
Even though,
know, I know.
yeah,
Yep.
Yeah, I done left that option alone. I'm thinking positive.
yeah.
I'm not
There you
thinking
go.
negative any longer, because he got me here for a reason. There's still
Hmm.
something I have to do.
Yep. Your work is not done.
No,
Every
it's not.
Your work is not done. Miss
It's
Angela,
not.
thank you so much. Thank you for Debo's hat. Thank you for looking out for him on that.
Devo's hat.
Yeah.
and, and thank you, and
Okay.
stay positive and continue to listen and keep us posted on how
All the
you
time.
doing. Okay.
Yep, I'll do that. Y'all all have a blessed weekend.
You-
And don't forget, Jermaine, Mr. Ride Out, we got Thanksgiving.
Oh,
We
What?
Thanksgiving.
got it together.
Mhm.
Well, thank you so much. I appreciate the sweet potato pie.
Ooh,
And
okay.
banana
Yeah.
pudding.
And
And the
banana.
banana pudding and the peach cobbler.
Don't
Ooh,
feed into Debo. Thank you, Angela. Thank you for calling.
thank you,
Yeah,
Miss
okay.
Angela.
Y'all have a good one.
You too. Well, after leaving Miss Angela, we continue to be positive and thoughtful about her. But I now want to introduce my next guest. This doc has been doing incredible work in the community, incredible work in the hospital. Dr. Kirk Ludwig, I can say I got words. He works in our surgery department specifically with colorectal cancer is one of the areas that he focuses on with the Medical College of Wisconsin. He's going to talk to us a little bit about colorectal cancer and what we're finding is that Dr. Ludwig, help us work through this. Younger and younger adults, one of my volunteers that we work with, she was diagnosed with colorectal cancer in her 30s. And we're finding that people are being diagnosed earlier in life. Um, Yet the guidelines for when people should be screened um, is much is in 45. So, but I'm finding I'm running into more people who are diagnosed early. And this is one of those that there can be symptoms, but it can go without being recognized. So help us walk through, why are we seeing people so much younger being diagnosed with colorectal cancer?
Well, first of all, no one knows for sure. That's the first thing we have to say. There's been a lot of research done on trying to understand why this is happening.
Mhm.
The bottom line is most people think that it has to do with our sedentary lifestyle, the lack of exercise,
Mhm.
eating ultra processed foods, processed meats. There's some thought that microplastics in the environment or in our diet have a role, and there's some thought that changes in the gut microbiome, the the bacteria in our intestines are being changed in some way, and this is what's resulting in the higher rates of colon and rectal cancer in young people.
Mhm.
But the bottom line is everybody is sort of looking for a silver bullet, like one reason, and we're probably going to find that there's
Many.
more than just one little thing going on here. It's probably a constellation of things that
Mhm.
is what's resulting in the high rates of colon and rectal cancer in young people.
So
But
that's one of the reasons why we say it's so important to know the family health history.
yeah,
Because if you know that your loved one, that your mother or father were diagnosed with a cancer at age 40, then we would start screening earlier, 10 years early, 10 years. So they diagnosed at age 40, we would start screening you possibly at 30.
yeah, exactly. Yeah, so for the average risk person,
Mhm.
that is somebody that doesn't have a personal history of colon cancer
Mhm.
or a family history of colon cancer or polyps, then you should start screening when you're 45.
Mhm.
So screening means that you're not having symptoms, you're just perfectly fine, you're just walking around, you just turned 45. It's time to have some sort of evaluation to look for colon cancer.
Mhm.
But in people that have a family history, that might change dramatically,
Mm.
right? So there's some people that are part of certain families that have genetic mutations that are
Mhm.
passed down from generation to generation, and in some of those people, they might start screening, when they're teenagers, and
Mhm.
in other families, they have different mutations when they might start screening where in their early 20s. Um,
Wow.
but if you just have a family history, like
Mhm.
your mom, your dad, your brother, your sister had colon cancer, then you might start screening earlier than 45,
Okay.
maybe at the age of 40 or 10 years younger than the youngest affected family member. So
Okay.
if your brother is 45 and has colon cancer, then and you're 35, it's probably time for you to get screened.
Mhm.
Yeah. So it can vary dramatically based on what your family history is, for
And
sure.
this is one of those cancers where if we catch it early, it's unlike other cancers. If you get your colonoscopies, like you said, you are at average risk.
Yeah.
No family history that you know of, no symptoms. If we catch it early, if you get your colonoscopy, they can remove the polyps, and that prevents it.
Yeah, exactly. I mean, there are only so many cancers that are like this where you
Yeah.
can the thing about colon cancers is they always start out as a polyp. And that polyp will start growing and it might grow for years
Mm,
before it turns into a cancer. It's not that all polyps turn into cancer, but basically
right.
all cancers start out as a polyp.
Mhm.
So you have a long period of time during which you could find that polyp,
Mhm.
get rid of that polyp, and prevent it from turning into a cancer.
Yes.
So that's um, the whole point of screening is to try to find polyps, to get rid of them, and
Mhm.
and then dramatically reduce the chances of a patient getting a cancer. And the other thing about screening is even if your screening study finds a cancer, usually when a cancer is found by screening,
Hmm.
before it starts causing symptoms, it's found at an earlier stage,
Yes.
and then the treatments are
Yes.
much more effective and honestly a lot easier
Hmm.
than if you have an advanced tumor. Yeah.
Awesome.
So
And
there are a number of good things about screening. The best thing about screening is what you would like to do is avoid getting cancer altogether,
altogether,
right? By
yes.
just getting the polyps out.
It's
Yeah.
yes. We have a caller on the line. Family, welcome, welcome to the table, welcome to the call. Good morning.
Good morning, ladies and gentlemen.
Good morning, sir. How are you doing?
This is Rick calling you long distance from Germany.
Hello, Mr. Rick. How are you doing? How are things in Germany?
Well, they're feeding me all the chicken, pork chops, and pork roast, steak, and beef roast that I can eat.
Oh, we're gonna talk about your diet. We need
But I just want to say that
please.
I know that eating like this will kill me,
Mm,
and the meat there in America is worse than the meat here in Europe, because of the way it's processed and produced.
mm,
Um, they're never going to tell you, as advertisers and insurance situation and medical professionals, that diet is critical to avoiding colon cancer in men and women, and especially if you're poor and you have um, you have not access to the best meat there in America.
mm. Yeah, thank you.
Ladies and gentlemen, I'm done.
Thank you, Mr. Rick. We appreciate you. That's one of the things, Dr. Ludwig, that we do talk about the diet and the importance of eating healthy. And you mentioned something, ultra processed foods. What are examples of ultra processed foods?
Well, like processed meats. I
Yeah.
mean, for example, like in Wisconsin, we eat a lot of sausages. So those are
Yes.
considered, processed and ultra
Hmm.
processed. If you just think about going to the grocery store, there's on the one end is all the fruits and vegetables, and then
Hmm.
everything else to the left of that is usually like stuff in boxes. That's kind of
The
all a little
ultra
ultra
processed.
processed. Yeah.
Awesome.
So you probably want to spend more of your time on the right side of the grocery store
Mm,
where they have all the
the
fruits and
fresh fruits
vegetables.
and
Yeah.
vegetables. Yeah.
And I mean, he's right. There's when you look at colon cancer, it has a lot to do with your diet. Now, again, it's not always you can have somebody that eats all the wrong things forever,
Hmm.
and they live to be 100 and never have colon cancer.
Hmm.
And then you can have somebody that is completely vegetarian. They exercise twice a day and every day of the week, and they get colon cancer when they're 50. So it's not an all or none thing. But if you look
Mm-mm.
at large groups of people that eat the things you're probably not supposed to eat
Hmm.
versus a group that eats the right things, the right things group is going to be better off at the end of the day,
Hmm.
right? So he's right, but it's not an all or none
Right.
situation, right?
Right.
But if you think about it, I mean, the colon cancer starts on the lining of your colon.
Hmm.
So everything you put in your mouth is going to go by those
Those
cells
things.
in your colon.
Yeah.
And over a period of time, what happens is some of those cells might be affected by what's going by them. And then they start behaving differently. They
Hmm.
get a mutation, they start to grow more quickly.
Hmm.
Then they get another mutation, first thing you know, you got a polyp, next thing you know, you got a cancer. So everything that goes in your mouth is going to go by your colon.
Hmm.
And so it definitely there's a diet uh, component to the risk for sure.
And part of what he mentioned was access. So if you don't live, and we have many areas in Milwaukee that you have to go pretty far to get to a grocery store. If what you have is a corner store that you frequent, you may not have that section to the right that's fresh fruits and
Oh
vegetables.
yeah, for sure. Yeah, if you're yeah, I know if you're eating from the corner store, you're not going to have great choices.
Yeah,
Right.
yeah.
That's right.
Dr. Ludwig, can you tell us a little bit about any symptoms that we should not ignore when it comes to colorectal cancer?
Yeah, so the trouble signs would be bleeding with bowel movements or
Yeah.
blood in your bowel movement. That for sure is a big problem.
Mhm.
Another uh, symptom that should never go, it should not be ignored, would be like a change in your bowel habits.
Mm.
So, like one day you just start having diarrhea for no good reason and it persists, or you start to be constipated for no good reason and it just keeps persisting.
Mhm.
Um, or you have a feeling that you need to have a bowel movement that just won't come out quite right, or you have this constant feeling that you need to have a bowel movement. That's a worrisome symptom.
Okay.
Or if you're having abdominal pain or like cramping.
Mhm.
Yeah. So these are all symptoms of colon cancers. But the thing is, most colon cancers, they don't cause much symptoms at all
Right.
if they're early,
Right.
right? So that's why it's so important to get screened, because a small cancer may not cause any symptom at all.
Right.
Um, or you might have a tumor in your right colon, for example, that's many feet from your anus, and it might be bleeding, but it might just be bleeding a little bit, a little
And
bit, a
not
little bit every
noticeable.
day.
Mhm.
And you'll never notice blood in your stools because it gets mixed in with your bowel movement, so you don't really notice it.
Right.
Um, so yeah, they can go for long times with no symptoms, right? So the
Mhm.
whole idea of screening would be to catch them before they start causing symptoms.
Awesome.
Yeah.
Awesome. And we have another caller on the line. Family, welcome, welcome to the conversation. Good morning.
Good morning. It's Angela.
Hey, Miss Angela, and do you have your
Yes,
radio
ma'am.
on? You need to.
I got it turned down.
Yes, ma'am.
Okay, so I'm calling because speaking of like with my father's side of the family,
Yes, ma'am.
you know I don't precisely know who my father may be,
Hmm.
but it's two individuals, but they're both deceased.
Hmm.
So, but I would wonder, like, because I have an IB, I have an irritable bowel syndrome,
Okay.
and I have a lot of problems with my stomach, and and my mom, she died from cancer,
Mm.
but it was in her lungs because she was a heavy smoker.
Mm.
But I was just like, with a lot of symptoms that I got going on, I wouldn't know how to trace it. If it's anyone on my father's side, because one father I know about his sisters, and but I know nothing about their health.
Hmm.
But the other father, I know nothing because I was his only, supposedly. I was
Hmm.
his only child, but I'm not sure if he's my father. You know what I'm saying?
Yes, ma'am. Yes, ma'am.
So how would I, find out? Like, I know I wouldn't be able to find out about the deceased parent, but like, cause I mean, I don't understand, cause they can never find nothing when I'm ill and I go to the doctor. They don't never know. They can't find out what's wrong with me, or they'll try to give me something like with my irritable bowel syndrome.
Hmm.
They're not giving me the right medication, so I don't have any.
So, thank you for that question, Miss Angela. Dr. Ludwig, what are your thoughts?
Yeah, I guess there's two issues there. First of all, yeah, not knowing your family history can be a problem, no doubt. If you're adopted or you don't know who your father is, that does make it a little tricky.
Mm-hmm.
Now, the thing with irritable bowel is, I'm sure when I was talking about the symptoms that you have with colon cancer, you would say, well, I have those symptoms like every day, right? So some days I'm having diarrhea, other days I'm constipated, because irritable bowel, causes, abdominal pain. It causes crampiness. It causes your bowel habits to change from one day to the next or one week to the next. And so the in somebody that has all those symptoms, it's particularly important to make sure that you're screened appropriately, because if you were to get a colonoscopy, um, then you would know that, okay, these symptoms aren't being caused by a colon cancer. Otherwise, you're constantly in fear that there's something, really not right other than just your irritable bowel syndrome.
Mhm.
Mm-hmm.
So if you already have baseline, symptoms, then you definitely need to have uh, you know, talk to your doctor about that and make sure that you're getting screened appropriately, so that you
Yeah,
don't.
because
It,
I'm sorry. Go ahead.
no, so that something is not missed, right?
Hmm.
Yeah, we always
Because
say that irritable bowel is a diagnosis of exclusion. So what that means is you have to exclude all the bad things that might cause all that crampiness, all that change in your bowel habits from day to day,
mm,
and then the number one thing you want to exclude in those cases is a colon cancer. And then once you had a scope and once you know there's not a cancer inside causing those weird symptoms, and you look at a bunch of other things and make sure those aren't really the problems, then you say, okay, well, this it sounds like irritable bowel. And then you'll be like, well, it's not great that I have all these symptoms, but at
Right.
least we know it's not
It's
cancer
not
now.
cancer.
Yeah,
Right.
exactly.
Right.
Hmm.
so how does, like, I got it like in my third after I had my last child. That's when it came about.
Mhm.
But how does that? How do you know that is it hereditary, or is it just something that can process during the time of your life? Irritable bowel syndrome, because I mean it's wicked.
Yeah.
Man, I mean I go through.
Yeah.
Yeah, it can come at any time in life, and it's a problem that is not necessarily cured. It's managed.
Mm,
So it's mostly managed through dietary and lifestyle modifications. So it is a tricky problem, and it does cause a lot of trouble for people for sure.
And Miss
yes, it
Angela,
does. Yes, ma'am.
The thing that to know is to be working with your doctor to let them know, and that's the one thing that's really critical. As Dr. Ludwig was saying, we need to be able to cancel things out, and to be able to have that colonoscopy, to be able to say, well, we know it's not cancer, and then
Hmm.
figuring out how to manage after that is always the issue. But that prevention of being able to check the box to say, okay, we've done this screening and we know it's not this, is really, really important. But having that relationship to be able to talk to your doctor and say, okay, this is still not working and I need to figure out, what I can do. And I know you mentioned before that you're going to holistic methods, and you just have to figure out what's right for your body. But it's
Right,
always important to have that conversation and have a doc that you feel comfortable speaking with. But thank you
right,
for
right.
this. Thank you so much
Okay.
for that question, Miss Angela.
All
Appreciate you.
right. Thank you all.
Um, so one of the things we talked about was col- uh, getting colonoscopies. And on the other side, we're going to take a quick break. On the other side of the break, I have that question, Dr. Ludwig. Everyone's favorite conversation.
Yeah,
How
sure.
do I prep for the colonoscopy?
All righty.
Yeah. So thank you, fam. Remember, give us a call, 414-444-5250, 414-444-5253. We'll see you on the other side. Good morning, family. Welcome back to Your Health and You. This morning, we are focused on our family tree, talking about cancer history with your elders. And we have moved into one cancer that you definitely need to know your family history. That would be colorectal cancer. We have Dr. Kirk Luckwood with us. And before we left for the break, um, I wanted to talk about what everyone always asks me whenever I do community education sessions is about the prep.
Yeah.
And I tell them I have a secret. I have a secret on how my husband and my doctor says we do couples colonoscopies. I go one week, he goes the next. So, but we schedule it for a Monday. So on Friday we have a really nice meal. Saturday, back it off a little bit. And then the prep on Sunday isn't as bad because we don't have as much to get rid of. And that helps me. But the prep is different for everybody. There can be the big jug that you drink, and there's different ways that doctors are doing it. So, Dr. Ludwig, what's your special sauce on how to make this happen easily for your patients?
Yeah, I mean, there truly is not a perfectly easy way. So you're basically, I mean, you have to get everything out of your colon. So everything,
Mhm.
in one way or another, you have to drink something that's going to flush your whole system clean. Um, and there are a couple of different ways you can do that, but none of them are particularly,
Enjoyable.
great. Yeah, exactly. So I mean, everybody of the and people that get screened with colonoscopy, that for sure is the major complaint you hear
Mhm.
is people don't like the prep. I mean, I just did one a few months ago for my scope, and yeah, it's not great. And yeah, but you just do it. I mean, the scope itself it should
Oh,
be
it's easy.
relatively painless. I mean,
You get a
they
good
start the
nap.
scope, they give you some
Yes.
medications,
Yeah.
and
Good
you're just
sleep.
like sleeping. Next thing you know, you're waking up and it's over.
Yep.
And so it's not that big a deal. But the day before, the morning of, with that prep thing is
Mm.
not that pleasant. But it's just a matter of getting everything out so that you can. The prep is actually super important, right?
Yeah. Yeah.
Because you want the scope to be done in a really, really clean colon, because
Mhm.
then it's more likely to find things if they're there. The worst thing you could do is have a prep and then find it didn't really work very well, or you didn't do it quite properly,
Mhm.
and then go to get your scope and then have them say, oh, the prep wasn't very good. We couldn't
Right.
really see very well. We have
Right.
to repeat this, in 6 months or a year. Then
Mhm.
then it's like you got to do it all over again.
Mhm.
So it
Mhm.
is important to get the prep right, and there's no easy answer for how to
How to
do
do
that.
it.
Yeah,
Yeah.
yeah.
What are some things that you want our family out here to know about colorectal cancer? Um,
Well,
typically,
the
yeah.
number one thing people really need to understand is about getting screened. Um, I mean, really, y- yeah, it's so important. I mean, it's just like I said before, it's there's only so many cancers that are like colon cancer in the sense that you have this precancerous lesion, which is the polyp that grows for a long period of time, that you can take out and avoid the cancer altogether.
Mhm.
It's just a kind of a unique situation that allows you to um, really, for most people, avoid getting that type of a cancer.
Mhm.
So you just have to talk with your doctors, talk with somebody, talk with your family. Just make sure that somehow you find your way into a screening program so you don't ever have to deal with it.
Mhm.
Yeah,
Mhm.
that's the most important thing by far,
Yeah.
and not to ignore symptoms. So if
Yes.
you're having symptoms like we talked about before, you just don't ignore them. Like we were just talking off air about like hemorrhoids and stuff. Don't assume that bleeding is from hemorrhoids. Don't find yourself getting constipated and assuming that, oh, it must have just been something I ate or whatever.
Mhm.
You have to be, you know, um, alert to the symptoms, and so that if you experience them, you can um, seek care for
Mhm.
them.
Mhm.
But really, the number one message always has to be, get screened properly.
Mhm.
Yeah.
And listen to your body.
Yeah, for sure.
Definitely listen to your body.
Yeah.
It's so important. And as we talk about this family health history, knowing it's one of the themes that we always say for the show is secrets kill.
Yeah.
And not knowing family history, and like Miss Angela said, not knowing, I was actually adopted, and I had a really good relationship with my doctor when I was younger, and we did, because I didn't know the history, we did started my mammograms to get a baseline when I was 30. But then I found my biological family, found that there was issues that I needed to do to pay attention to. And so a lot of the screening started earlier, but it was because I wasn't sure. And I had an awesome, awesome primary care doc who was like, okay, we're going to go ahead and get baseline because we don't know anything.
Yeah.
And you are showing some symptoms that are concerning me. So
Yeah.
we're going to do this now.
Well, the other thing to recognize too is that so certain families carry mutations throughout, like every cell in your body has
Yes.
a particular mutation, and those mutations can make it such that your family risk for getting colon cancer is quite high. But
Mhm.
some of these mutations also increase the risk of other types of cancers.
Mhm.
So when you're talking to your family and stuff about, cancers that have
Mhm.
occurred in your family, it's not
Mhm.
just colon cancer.
Mhm.
It's breast cancer, it's stomach cancer, it's,
Mhm.
gynecologic tumors, it's
Mhm.
cancers on your kidney. There's a bunch of different cancers that can occur in families that have these certain mutations. And
Mhm.
so it is really important to, like when we see a patient with colon cancer, we'll ask them, is there a history in your family of colon cancer?
Mhm.
But the next question we always ask, and they say, yes or no, but the next question we always ask is, are there any other cancers in your family?
Yeah.
So what we're looking for is we're trying to figure out, like, yeah, is there another cancer that might alert us to the fact that this is a family that has one of these particular mutations
Mhm.
that we need to investigate?
Mm.
Yeah.
There's actually a good friend of mine, one of my sorority sisters, who is very vocal. She about her cancer. She, Mrs. Sherry Rogers, had um, I'm gonna say Lynch syndrome.
Yeah, Lynch. Yeah,
Lynch syndrome,
exactly. Yeah.
and then her daughters did do the genetic testing.
Yeah.
So it's something that you do have to be aware of. And we have a caller on the line. Family, good morning and welcome.
Yes, good morning.
Good morning.
Yes, yes, my question has to do with how does information get from the public to the physician? I mean, what I'm asking, let's say, for example,
Hmm.
if people are observing particular things, and as he was saying that people are observing that there are more colon cancers now and
Hmm.
in younger people. So the information has to go through a research project, right, in order to get to the physician.
Okay, I know what you're talking about. Yes.
And
Oh.
and then one thing that I had noticed that occurs more now than it used to be is in terms of the wipes that parents use for cleaning the children.
Oh, for baby wipes.
Yeah, and when you look at some of the ingredients on those, a lot of those ingredients are not what we call natural ingredients.
Hmm. Hmm.
And so if someone observes something like that, okay, how does it go from someone testing and see if that's actually something that's contributing
Hmm.
to? So that's my general question
Hmm.
is how do things go from being observed by the public to actually becoming part of the um,
Our guidelines
you
or
got yeah, the
practice.
guidelines. Thank you.
Yeah, no, no,
Yeah,
it's
I'll hang
okay.
up and listen.
No, thank you so much. That is an awesome question. So a lot of times, um, doctors see things that they're curious about. And this is one thing I tell people, where I'm so blessed to work at the medical college, because I could turn a corner and find somebody who's going to ask a question about a question. And our researchers and our doctors are very, very they're inquisitive, they have questions, and they want to know, why is this happening? So things go from practice. So we may see it in a population, see something happening, like what's happened when we've seen that younger people are getting diagnosed with colorectal cancer. So someone, and I can't remember who, you might know who started the study, Dr. Ludwig, um, but they started looking at the numbers and identifying that this is a pattern that we're seeing. And they can look at it and say, this is happening for a large group of my patients. This is happening for a large group of patients in this community, stretch it out to this region, and then go nationwide. And they start to publish it. And then after they start publishing it, um, they other researchers start looking at it also and trying to find out why. They want to know this why. And as Dr. Ludwig said, because of everyone asking these questions, there's not one why, because we're all different.
Yeah, I mean, first of all, I will just say that everyone that treats colon and rectal cancer has, unless your eyes are closed, you recognize that there are just so many more young patients with colon and rectal cancer. So, of
Mhm.
course, yeah, you say, what the heck is going on here? And then when it comes to research, everybody starts to say to themselves, well, it's just like any research. You come up with a question and then you say, well, we have to investigate that question.
Yeah.
So, for example, I'll just tell you, like our group, we just published a paper, I don't know, in the last year, looking at obesity rates in young people that have colon and rectal cancer. So that the overriding theory for why all these young people were getting colon cancer at a young age was that they were obese, because there's an obesity epidemic in the United States, right? There's
Mhm,
just
mhm.
a lot of people that are overweight. So everybody said, well, it must be that the weight problem is what's causing all this colon and rectal cancer. So we looked at a large group of patients that are young, that were obese, and we didn't really find an exact correlation between obesity and getting colon cancer. So while obesity may be part of the problem, it's probably not the only part of the problem. It might
Right.
have something to do with it, but it's not the only issue. For
Mhm.
example, we see young people come into the office that are, skinny, perfectly healthy and
Mhm.
fit, and they have colon cancer. And then you would say, well, okay, that obesity thing doesn't fit for them. There must be something else going on here, right?
Mhm, mhm.
So there's a lot of people looking into this, trying to figure out, what it is. And like a lot of things in medicine, it's rarely a single little thing, right?
Yeah.
Because the body is complex. There's all these things happening. So it's not usually just one little thing that kicks
Mhm.
it off. There's a constellation of things that would bring on the cancer.
Definitely. And as researchers and doctors do research and they ask questions, they start to look at, to be able to try to identify that trend. And one of the things, when we just recently, feels recently because it just it happened a couple years ago, when we changed the age for colorectal screening,
Yeah,
it was because they were seeing an uptick across the country and beyond of individuals that were younger.
yeah,
And so it was put to, there's a group of individuals um, that are much smarter than I, that who sit together and look at the trends, look at all of the research that's being done, and say, okay, we need to reduce this screening age.
yep, exactly. Right. It was just a few years ago that the screening age was 50, and everybody started to recognize that there's so many young people that were being diagnosed that we needed to reduce that age. And there's already people calling for reducing it even further.
Mhm.
It's a complicated calculation in terms of when you start screening. It has to do with it's like a public health issue, right? So
Yeah.
there's all these things that go into it. It's a little complicated, um, but yeah. So every time we see a patient that's 30 something years old that has cancer, they're like, well, even screening at 45 wouldn't have found this thing,
Right.
right? So
Right.
yeah, it's ultimately it could come down to a blood test. This
Yes.
is the ultimately what people would love to do, is be able to find a blood test. And there's a lot of investigation into this too. So basically you would draw some blood and then look for DNA fragments in
Mhm.
the blood, that are indicate that there's a cancer in your colon.
Mhm.
So this is a little futuristic, but it's already happening. We do this kind of testing on people that have colon cancer to make
Mhm.
certain decisions about
Mhm.
what to do with their colon cancer.
Mhm.
But ultimately, there's a lot of research into trying to find a blood test that would tell us um, who does or does not have it. And
Mhm.
so then that would be, obviously hugely helpful.
Yes.
Yeah.
Yeah, there's a lot of research that's going in, and the process, it's to your question, it goes to research. I mean, communities find it, and what at the medical college we call you community scientists, because you are going through the lived experience, like Mr. Hayes going through that experience. You become a community scientist. So you bring up things that's brought up to doctors and many doctors, and then they start looking into it, like Dr. Ludwig mentioned the obesity factor. But most recently, what actually changed was the screening age, and it goes to a panel, and the panel looks at the research and then makes that determination. And then insurance, usually it's Medicare that picks it up first, and then insurance companies shortly follow suit. So part of that is it is a process. Unfortunately, it is a long process, but this is why this show emphasizes having those conversations and why it's so critical. Because if you know you have a family history, that gives your doctor more information to go on to help diagnose whatever's going on that's wrong. Um, but yes, well, I really appreciate that. And Dr. Ludwig, we talked a little bit about putting things into your body and the impact that that can have in changing um, your microbiome, or the lining of your intestines. And we're now going to jump to still putting things in your body, and talk a little bit to my next guest, who I so appreciate. We just sat in a meeting together yesterday. We are serving on the Lung Cancer Coalition, and doing some work looking at this. Miss Molly Collins, I appreciate you. Thank you for coming from the American Lung Association. Putting things in your body. Ooh, this is a hard one. This is
This is.
this is a hard one, because we were just talking yesterday a little bit about how you identify um, things that you can do to harm your lungs. And November is, we call it the Great American Smokeout, where we try to get people to stop smoking, acknowledging, we were talking about this, how hard it is. I know at Frater Cancer Center, part of what we started looking at, or that we've been looking at, but now it's being put more as a priority again, is looking at people who smoke after diagnosis, and because it is an addictive behavior. And can Lung Association just do away? Come on, y'all can do let everyone know.
I mean, I think we all know how bad smoking is for us, right? But it's an addiction, and you can't downplay it. People say it's as hard to quit as using heroin, right?
Yes,
So
yes.
like it's going to take people a number of times to try to quit smoking, and that doesn't mean you should give up. If you've
No.
tried before, just when you're ready, try again. Talk to your doctor about getting cessation medication, because it really does help. Like, you don't need to quit cold turkey. We know that the most effective way to quit smoking is to get help, get counseling, talk to other people in your life about it. You can call the quit line, which is it's 800 quit now, and or look at the website, which is wiquitline.org, and you can get help quitting today, or whenever you feel like you're ready to do that.
And you said, and again, that's 1-800-QUIT now.
Yes.
And wiquit.org. Did I get that?
Quitline.org.
Quit line. Look, don't listen to me, people. Family, I can't write and think at the same time. So if I want to stop, if I say I'm going to stop smoking and instead I'm going to vape, I'm going to use vape, is that better?
Well, we say quit, don't switch, right?
Thank you.
Because the tobacco companies are for-profit institutions that are killing their customers, to put a a pretty real point on it, right?
Yes,
Like,
yeah.
and we know that they're switching up their tactics
Mhm.
to addict more people. And
Mhm.
so vaping, I know people anecdotally who told me they quit smoking by transitioning to vapes and then stopping vaping, but like most people don't do that.
Mm-mm.
And if vapes were like the right way to quit smoking, it would be an FDA approved medication. It would be covered
Right.
by your insurance.
Right.
Right.
Yes.
So we want people to quit by using those approved medications that really help. We know they help. There's a lot of evidence to support that.
And that's one thing that you and I have talked about. There's so much stuff that just went through my head. And then so you and I have talked about is hookah. There is not, so this, I'm now talking to my researchers out there, my docs. We need more data, more information on the dangers of hookah. And it's not something people don't, I tell the story, my daughter, when she turned, it was either 18 or 21, I can't remember, when she could get into a hookah bar. And her friends were like, "We're going to take you to a hookah bar." And she said, "Oh, Mom, I'm going to go to a hookah bar." And I was like, I worked for the American Cancer Society at the time. And I was like, "No, you're not." And she's like, "What do you mean?" And I was like, you're going to smoke?" And she's like, "It's oxygen." And I was like, "No, it is not." And so we sat down and we looked at it and looked into it. And then she got mad at her friends because she said they were trying to kill her. So and she dances professionally. And so she was like, "You're not doing this to my body. Do you understand what harm this can do?" But there's not enough research. And I don't know if doctors are across the line asking that question. They may ask, "Do you smoke?" And in our minds, as community members, we will say no, but don't realize that vaping and hookah is still a factor in that question.
Right. Or cigars or other
Cigars,
things
yes.
that folks are smoking, and tobacco companies, they're the innovators, right? They've been targeting the community for a long time, and they keep coming up with cool new ways to addict customers. So
Yeah.
it was vapes 10 years ago. Now they're coming out with these new metal cigarettes. Like, it's all the things that we just want to, like, think about. How do we make sure people are understanding, like, it's not actually healthier than
Mm-mm.
not smoking,
Mm-mm.
right? Like,
Yes.
vaping may be slightly healthier than not than smoking cigarettes, but it's not healthier than not
They're
smoking.
not
And
smoking.
so, we'd like folks to really try to make sure that they're making the healthiest decision for themselves and their families.
And a big part of what the American Lung Association does is advocacy. And the advocacy is a piece of going to our legislators and educating them about the impact legislation has on our communities. And most recently, there's been a bill in Wisconsin. And can you describe a little bit of what that bill is and the impact it would have on our communities?
Yeah, sure. I mean, there are a few bills that we're
Yeah, I
working
know.
on in the legislature right now, but one bill that passed recently would basically allow smoking back in bars of tobacco products. If the bar started selling tobacco, then they would be able to smoke cigars, brown cigarettes, which are still sold in packs of 20, still look
Yes.
exactly like a pack of cigarettes.
Mhm.
Hookah and pipe tobacco, you'd just be able to smoke in the bars again. And we've had a smoke-free indoor air law for 15 years in
Yeah,
Wisconsin,
it's
and
been nice.
it's been nice. Like, I don't have to go home and wash my hair when I go out.
Thank
Like,
you. Yes,
you
put the
know,
clothes in the
put the
garage.
clothes in the yes. We Nobody wants that anymore.
No.
So, we people universally really appreciate the smoke-free indoor air law, including smokers who I know who are like, oh, I don't want to,
Mhm.
be around all of that again.
Yeah.
And it makes it harder to quit too if that's
Yes.
happening in the places that we hang out socially.
One of the things also, secondhand smoke. And I can remember both of my parents were smokers. And I would sit in the back of the car and we loved to go camping. And I've camped in almost every state. We would drive cross country. And even in the wintertime, driving cross country, windows rolled up, and my parents smoking. And my parents acknowledged when after they quit, that my issues that I've had with asthma, other issues I've had with breathing, that it's probably due to the fact that we rode in enclosed cars all the time with both of my parents smoking. So the secondhand smoke, not only in being in an environment where people are smoking, but also it, like we were talking about, it sticks to your clothing. And that's something that actually people can inhale. So if you are a mom and you're smoking, and then you pick up your baby, the baby is inhaling that secondhand smoke that's onto your clothes.
Yeah, I mean that's right. We want to try to keep smoke in all of its forms away from kids, especially, and folks who don't have a choice,
Yeah.
including people who work in bars, right?
Right.
So
Right.
so
So
we
true.
we that's one of the reasons we don't need smoking back in bars in Wisconsin.
Exactly. Well, family, we're going to continue talking about this on the other side. I want you to join in with us on the conversation. The number 414-444-5250 or 414-444-5253. We'll continue this conversation on the other side. Thank you. I'll tell you, we need to get the conversations offline that we talk about. Um, just poor Mr. Hayes didn't know, not poor Mr. Hayes, but fortunate Mr. Hayes didn't know what a hookah was. We were talking about that and explaining that a little bit. But it's so we talked earlier with Dr. Ludwig about the importance of screening. Molly, lung cancer screening. One of my favorite topics because it's one that's it's difficult because it's really based on the medical community doing a full assessment and community self-reporting, the patient self-reporting accurately. And so, what is the screening guidelines for lung cancer?
Yeah, so it is like way more complicated than our mammogram or even our colorectal screening, right? We need to be in conversations with our doctors to let them know if we've been smoking. So, specifically, people are considered at high risk for lung cancer if they are over 50 years old and have a 20-year pack history. So, this is where it gets a little complicated. So, it's like one pack of cigarettes a day for 20 years or 2 packs a day for 10 years, and if they're a current smoker or have quit within the last 15 years.
So, if I only smoked a half a pack for 20 years,
I mean, you should still be in conversation
still in the
with
conversation.
your
Yes,
doctor about it,
definitely.
right?
Yes.
Because what we know is a lot of like women and people of color are excluded by some of these pack year requirements. They actually lowered that in 2021 because they realized that they were accidentally excluding a lot of folks from screening guidelines. And so having conversations with your doctor, especially if you're also smoking other products like as we were talking about hookah or cigars or marijuana, making sure that we are just keeping our doctor in the loop so that they know what the appropriate screening to recommend is. Because the thing with lung cancer is a lot of those cases are caught very late.
Yes.
Because people don't get screening, and then you just have fewer options for treatment.
And understand your doctor is not there to judge you. If you're smoking anything, if you're inhaling anything that is not oxygen, it's like you need to make sure that your doctor's aware. If you're smoking marijuana, let your doctor know. If you're vaping, if you are, with the vaping, the interesting thing is that I believe some statistics that I looked at a while ago, and this was through some work that the Wisconsin African American Tobacco Prevention Network was doing, that they're starting as young as with vaping as 8th grade.
Yeah. And maybe even younger than that.
Yeah.
We hear about a lot of vapes being confiscated in middle school.
Ugh.
And like kids that young are really doing long-term damage to their lungs and don't understand. And it's an addictive product.
Definitely.
And now they're easier and easier to get at like every gas station.
Yes. And part of you were talking about the producers, the tobacco industry. They say they're not targeting kids, but I will tell you, I think you and I have talked about this before. I saw a vape hoodie, and this vape hoodie, it's under $60, and it is an actual hoodie, and the strings are actually the vape part, and so you can be sitting in a classroom vaping, and no one would know. That's not what an adult would do. An adult does not need to hide. But if you're targeting children, that's when that becomes something that a product or a method to get it to them would be used. And it's very frustrating.
Yeah, absolutely. And I mean, I guess I would also argue that if you're making flavors like bubblegum and like cotton candy, like probably that's not targeting adults either.
No. Yeah. Yes. That's the same thing when we think about when the mints cigarettes and was it Cool Mint, whatever it was called. Yeah. It's targeting populations and it's increasing that addictive behavior, which is very, very frustrating.
Yeah, that's right.
So if I know the first step that I want to urge our community is just have very open and honest conversations with your doctor. Your doctor is not going to judge you, not going to call anybody and say, "Ooh, this person's smoking marijuana." But it's if you are smoking anything that your doctor needs to know, because that's information that helps them plan what your prevention um, steps will be. And with the skin cancer, next topic, with the lung cancer screenings, what exactly, so you fall into that category, then what happens after they decide that you should get screened for lung cancer?
So then they would recommend you for a low dose CT scan,
Okay.
which is pretty simple. There's no prep.
No prep. That's a plus.
That's a plus. So you go and get scanned, and they take a look at your lungs, and then if there's anything concerning, they'll probably recommend you come back and get scanned again in a couple months to see if that's a cancerous nodule that's growing in your lungs.
Yes, definitely. So we talk about the screening, we talk about the importance. What's been some of the gains, some of the things that we've done that's made a difference in lung cancer in our communities?
I mean, the screening itself has been a game changer. So the American Lung Association puts out a report every year called the State of Lung Cancer Report. And just like in the last 5 years, the survival rate of lung cancer has increased significantly, by about 26%. And that's because people are getting screened. Lung cancer used to be a much, it is the cancer that kills the most people in the United States. And so we really want to make sure more people are catching it early and being able to treat it.
Awesome. And we have a caller on the line. Caller, welcome, and good morning.
Yes, good morning.
And please turn down your radio. We're getting some feedback.
Okay,
Thank you.
this is Angela calling back.
Hey, Miss Angela, you should just be here in the studio, shouldn't you?
I guess I should.
Come on, Miss Angela. Good morning.
Okay, my question is, so, like, I understand that cigarettes can give you cancer, but like y'all talking about other things, do that has anything with, like, can you get cancer from smoking other things?
From smoking other things like the vaping, the
Marijuana,
hookah, the
crack, or
marijuana.
all that other
Yes,
stuff.
all of that. So one of the things early on when I first started working at the American Cancer Society, I remember someone saying that anytime that you inhale anything that isn't oxygen, you're putting yourself at risk. So
Okay.
if you need to really make a determination, and I know a lot of people, I know not a lot of people, but I know some people think that, but I'm not smoking cigarettes, I'm smoking marijuana, and I know it doesn't have the processing that goes everything, but you're still inhaling something that can be harmful to your body.
Okay.
So yes, it is. If you're not inhaling oxygen, you are putting yourself at risk. So Miss Angela, I need you to tell everybody that it's something that we need to be aware of, and that they need to tell their doctor if they are smoking anything, period, because
Right.
that helps your doctor
To know.
and to know what they should be looking for. If you
Yeah.
don't tell them and you keep it a secret, then it's difficult, then it's harder to know.
Deb,
Yeah.
Yes,
Because
sir.
I was always with my doctor. I had a close relationships with him because I get to know him, and I'm honest.
Yeah.
Back in the day, I was smoking crack, and I would let him know. This is my drug of choice, but it's no longer today. But
Right.
I'm honest with my doctor because we have get a better understanding with one another. If
That's
you be
awesome.
honest with him and let him know
Yes.
what kind of lifestyle you living.
Awesome. Thank you, Miss Angela. That is words to live by.
Okay.
Mr. Debo.
granted, inhalers, things of that nature for people who have issues with breathing
Yes.
are intended to, like a steroid, what have you, maybe open it up, help them breathe. Is the potential to damage the lung there from even medications intended to help you breathe?
No, they should not have that kind of damage, because that is medicine. That's one way to get medicine in your body, and it's the inhalers and things that help open up your lungs, steroids that you may use to open up your lungs. That's an intention, that the intent for those medications is to help help cure and alleviate any health issues you have.
So I have a quick question. So with all of the pollution that's in the air,
Yes.
with cars and factories and things like that, don't that play a bigger part with the cancer in the lungs than smoking do?
Environment is key.
Environment is absolutely key, and you are absolutely right about that. But tobacco use increases your risk of getting lung cancer by somewhere between 15 and 30%.
Wow.
So, or 15 to 30 times. I'm sorry.
That's
So,
worse.
Yes.
that is the number one cause. We just know that that's it. But there are a lot of people who get lung cancer who do not smoke, and
Right,
so
right.
that is, we're seeing much more correlation to that air quality that we've been seeing, right? We've seen wildfire smoke, pollution. Milwaukee regularly has like poor particulate matter
Yeah,
days from the traffic and whatnot. So all of that we have to be thinking about, but like we control the parts we control, right?
So that's like secondhand smoke, right?
It is.
It is.
So, okay. So for the people that don't smoke and you are around a person that might have a cigar or something like that,
Mhm.
that's terrible for you as well, right?
Yes.
Yes.
Okay.
Yeah.
Because I mean, by me being a musician, I was playing at this cigar bar,
Hmm.
and I actually stopped playing there because I noticed when I would leave, like I would be like clogged up. I'm clogged up, and you know my sinuses was going crazy, and so I would drink a lot of water to try to flush it out, and then I realized like, wait a minute, it's all of this thick smoke that I'm sitting under. I'm playing, I'm entertaining, but it's causing me to feel some kind of way.
Yeah.
Yeah,
Yeah.
absolutely.
And that's one of the things with the indoor air law. If they change that in bars, can you imagine how different it's going to be in those settings where people normally go to watch a game or
Yeah.
things like that? It's with people smoking right next to you. It's that secondhand smoke that you're definitely going to feel.
The other like environmental piece I want to talk about today is radon, because not a lot of us know about it. I definitely didn't really know about it before I had this job even. But radon is a colorless, odorless gas that just it's naturally occurring and it might seep into your basement. And Wisconsin has really bad radon levels. And radon turns out to be the second cause of lung cancer, second leading cause behind smoking. So we know that folks who are exposed to radon in their homes are also have an increased risk of lung cancer.
Are there radon detectors?
There are radon detectors, and there's also like a pretty easy test that you can access. There's the Milwaukee Fresh Air Collective is helping people in Milwaukee access those. You can call them and get a test, and you just put it in your house. It's like takes 48 hours. You mail it in, and then if you have radon in your house, and then you can mitigate it, or you can talk to your landlord about mitigating it if you're not the owner of the home.
So what about mold?
There's so many issues with mold.
There's a lot of issues with mold.
So would that
Mold
cause
is
cancer?
I don't know about if it causes cancer. It certainly causes and exacerbates asthma, which is
Right.
another issue I work pretty closely on.
Okay.
So, I mean, all of these things impact our air quality. We want to do the best we can to make sure that the home we're living in is really healthy for us.
Definitely. And we have a caller on the line. Caller, welcome to the conversation. Good morning.
Good morning. I was just calling with the comment of excellent show. Happy Thanksgiving.
Thank
And
you.
I have my notebook for when I go down to Memphis next week with my people to get their history. I'm writing and documenting it down.
Awesome. I so appreciate that. And when you're around with some young folks, make them record it on their phones. That's the easy way to do too. Have them do video recordings. Use that iPhone and those Android
Put it to
phones.
use.
Yeah, for something fun. Capture that history. Capture that history. Thank you so much, Colin. Appreciate you.
Today and again, excellent show. God bless.
Thank you. God bless. So we talk about environment, and there's certain zip codes at times that also have major issues of air quality. The radon is definitely, you can see that in certain communities just with older homes and things like that. And the mitigation, we talk about that, and it is something that the landlord, if you are renting, would have to move through. But understanding the zip codes of areas that also have high incidence of lung cancer, high incidence of colorectal cancer, um, things that we need to recognize. How important is that also?
I mean, all of those things that you're talking about, the social determinants of health, they are critical. And part of that is also like accessing healthcare, right? And making sure you have a primary care physician and you are able to go to one. Do you have insurance, right? All of those things, healthy eating, they all play an important part in both our risk factors and then also how we are able to access treatment.
Awesome. Yes, yes. Well, I think I really feel like there should be a part two to what we did today, because we got a lot of callers in. Thank you, family, for calling in. And also tons of really good information with Dr. Ludwig talking about colorectal cancer, uh, clarifying some things for us around the prep. Molly definitely talking about, and I think what we need to come back and talk about is this whole stopping smoking and what that means as far as preventing cancers and the health of families, because we've talked about that environmental impact. And I know the one thing when I was growing up, seeing my mom smoke, seeing my dad smoke, I thought, well, that's what cool people do, because my parents are smart, they're intelligent, they know what they're doing. And I remember getting to college and trying to smoke, and like, no, that was not, I hated it. It was, and then the cost of a pack of cigarettes, Lord, nah, that cost was prohibitive for me when I was in college, and I immediately was like, nah, this is not what I'm gonna do. This is not a choice. But making those choices and also having those conversations, is there anything that you, for this time, because you're going to come back. We're going to have you back again. Um, Anything that you want the community to take away from our conversation today around lung cancer and the American Lung Association?
Yeah, I mean, I think like one other thing to do, you brought up your parents and just talking to our young people about these issues, because they might be vaping and parents might not even know about it, because like it's a lot easier to hide those vapes, as you were saying, in a hoodie, or I've seen ones that look like little USB drives for your computer or whatever, right? So like just having those conversations in your family and making sure we're all like we have the information to not fall victim to these tobacco industry tactics.
Didn't Milwaukee recently ban the sale of those products in certain stores, types of stores, like corner stores? I think you have to be a full-fledged tobacco store to be able to sell it. Now, I know I saw in some stores they removed those types of products.
So there was a state law that passed about a year ago that actually was supposed to take some of what they called the illegal vapes off the market, and some of those are those flavored products. And that's a very complicated question, but it they're not all off the market, and that you can still get them in Milwaukee.
Definitely. And Dr. Ludwig, parting words regarding colorectal cancer prevention. What do we need to do? What do you feel is key for individuals to know?
Eat right, exercise, and when the time comes, get yourself screened. You don't have to get colon cancer. And it's much easier to avoid it than it is to deal with it once it's come. So try to do the right things and get screened. I mean, just when you get to the age, you just have to talk to your doctor. Say, look, I need to get screened. Hopefully, the doctor would mention it to you, but it's always helpful if you mention it to them. So when you're 44 and your 45th birthday is coming up, you just need to talk to your doctor. Say, look, it's time to get screened. And if you know there's a family history of colon cancer, if you know there's other cancers in your family, make sure your doctor knows that and sort of advocate for yourself. Say, look, do I have to get screened earlier? And and get it done.
Definitely.
Yeah, don't worry about it. It's so
No.
nice. Like I said, I had my scope done a few months ago, and it's always a little nerve wracking to get it done, right? Because you're like, oh my gosh, I hope they don't find anything. But then when you get it done, you're like, okay, phew, that's good. Or if they do find something, you're like, ooh,
They got it out.
got
They
that
got it.
out. Yeah.
Yeah.
So it's actually nice afterwards,
Mhm.
to know that you're good.
And you're
Yeah.
squeaky clean.
And
Yeah,
you're
exactly.
squeaky clean.
And I've picked up a few people from their appointments, and they're very happy. Like,
I was happy, very happy.
I always say you get a really good nap and you don't like,
Listen,
ooh.
I was counting sheep. I mean, they was jumping over the thing.
And that's what's so important. Don't be afraid of doing it. Don't be afraid of preventing. What's really important is to have that conversation with your doc and knowing how much we love Dr. Ludwig and how awesome he is. We don't want to see him.
Yeah.
It's you don't want to get to the point where you're seeing a colorectal surgeon. That's one piece we don't want to do. The one thing too I want to tell you, as I mentioned earlier about community scientists, on December 11th we'll be having a prostate health equity project idea lab. I'm not going to tell you what that is. I just want you to be there. Give me a call, 414-955-2364, and I'll give you more details on how to register to be present for that. Very, very important conversation. Again, on December 11th, Prostate Health Equity Project Idea Lab. That's 3 days after Mr. Hayes' birthday, his 85th birthday, which Mr. Jermaine's going to be throwing a party for him.
I'm taking all this.
And it's actually 8 days before my birthday, so come and celebrate. At the Prostate Health Equity Project Idea Lab on December 11th, and give me a call, 414-955-2364. Family, I have to thank my guests, Molly from American Lung Association, Dr. Ludwig from Medical College of Wisconsin Cancer Center, Mr. Hayes, as always. So just pre-birthday celebrations. Of course, thanking Mr. Debo, Mr. Rideout. Without y'all, this is not possible. And without you, family, community, calling us, asking questions, and telling us what you want to hear. This would not be possible without you. So we do thank you all, and we look for you on the other side. Remember, family history is a gift. Let's use it to protect our future. Thank you, and have a great Thanksgiving.